My job is to elicit the most amount of information from the stellar panel. There's no one on the face of the earth that knows more about the topic than they. So I'm going to push them to be cogent. I'm going to make sure that questions are asked in a manner that gives us information, but also to maximize the time that we have. And we're going to do all of this we're going to end on time for lunch. That may be what people put in the evaluation, that they ended on time for lunch. So I want to make sure that that happens. My name is Reverend Dr. Alfonso Wyatt. I am both a board member of the Interfaith Center of New York, and I guess I can say the chief architect for the Rabbi Marshall Meyer retreat format that we are in right now. I've had the pleasure of working with the staff and our leader, who I greatly respect and work with, and for the leader of this, the Rabbi Marshall Meyer, one of my dear sisters and friends, Dr. Sarah Saeed. So I say all of that to say that this is a dream come true. And the questions that you are asking about how can ACS reach out beyond the usual folk are the right questions. And it is the dream, I believe, of both the Rabbi Marshall Meyer retreats and also the Interfaith Center of New York to be a concourse of ideas and to make sure that all who want, and especially who want to help children, come together. I am happy to say that I'm known both on the sacred and secular side. And most of the people that you have met and heard from they're real people. They're not just government talking heads or somebody just kind of dropped out of the planet, and they're here working. The young lady sitting next to me I've known for many years, long before she went or was hired by ACS. So what I'm going to ask each and every one of you to do, if you can weave in some of the questions or responses in your response, whether you're ready to do that, you do know how to do that. I'm going to ask for you to take X amount of time, and then I'm going to open it up. You decide the flow. I'll sit here as patiently as I can. They gave me these things, so I don't think I'll have to use them though. You know, we hitting it. So I'm going to turn it to my dear sister and friend, Dale Joseph.
All right. Thank you, Reverend. And it's a pleasure to sit next to you and to be part of this dream that you designed and developed. I think it's an important dream, and I think you're the right person to be at the head of it, because I think the passion you bring and the commitment and the experience you bring makes all the sense in the world to have this convening wrapped around this important topic. So what I would like to talk about a little bit is just the community partnership program. I know that many of you had some questions about how the faith community can be involved in this work. So I'll provide a little bit of a backdrop on what the CPP is and where it all began. And so someone mentioned earlier that the mission of ACS is really focused on three things. And I look at it as a three-legged stool: safety, permanency, and well-being. And so the CPPs were created within this context that if you create a network around families, remembering that children exist within the context of families, families exist within the context of communities, children will be made safer, permanency will be achieved, and families' well-being will be even more enhanced. And so that's the premise upon which the Community Partnership Program was developed by ACS. It's not a new model, it's something that has been tried and tested in other jurisdictions. It was modeled after the Annie E. Casey Foundation's Family to Family program, which you can all, of course, look into if you're interested in finding out more about the model. But essentially it's about using a neighborhood-based approach to keep families safe, and as the commissioner talked a lot about, to prevent children from actually coming into our system rather, and to receive preventive services. So the model was formalized in 2007 with funding attached to it, even though ACS had been engaging in various forms of neighborhood-based services since 2001. And we are now a relatively lean unit, but if you think about the core unit being quite lean, but then the neighborhood networks being very, what's the opposite of lean? Fat. Healthy, right? So when you think about it, the 11 partnerships that were mentioned, and their brochures coming around, those partnerships represent over 400, maybe 500 individuals. And the idea really is to make connections happen on a local level. There's no work that we can do at ACS that does not include the community. Our children live in these 11 neighborhoods, and while we would love to have expanded our reach, we are at this point focusing on 11 communities where most of our children come from, children who are involved in our ACS system. So I will talk a little bit about the types of individuals and systems that are involved in the partnerships. I think some of you may have got a sense of that. But essentially, there are community residents, there are faith-based leaders, there are anyone from the community who cares about children and their safety. It could be, for example, a school crossing guard. It could be someone who's very interested in learning how to identify signs of abuse or neglect. It could be a local vendor who might be providing services to families in need, free of charge, for example, because that person is compassionate and cares about keeping children safe. The idea of the partnerships is that it's not just community providers, but it's people who are the eyes and ears of the neighborhood. It could be the retired grandmother or grandfather who cares about children. And so we look to the community to strengthen families through these networks. The networks essentially convene once a month. Some meetings are probably as large as this or even a little bit smaller. They talk a lot about the work that they're doing that ACS has contracted them to do. That's one piece of it, and I'll talk a little bit about that. But in general, the idea is to network, to find out who exists down the block. What neighborhood program can help this family that I'm working with within this childcare agency, for example? How can my preventive agency find out about a mentoring program that they may not have funding to provide? So it's that kind of networking process that occurs. So in terms of the areas that we focus on, or we ask the partnerships to focus on, and I know Flora will probably talk a little bit more about that, but I'll just focus on the 5 key areas in general, and then certainly feel free to fill in the blanks that I may have left out. So one of the areas is conferencing. So obviously much of the work that we have done over the years at ACS has to do with including the family when decisions are being made about whether or not children need to be removed for their safety. We have transitioned, and so the community folks that we have been working with that have been supporting families around that decision-making process, we're shifting their roles. So they will be working in the conferencing model that ACS has set up, but in a different capacity. So that may mean that they're sitting in on what we call an elevated risk conference, where it's determined that there are some serious issues going on in the home, and someone from the community can sit in with that family with ACS. So it's not just ACS sitting at one end of the table and the family sitting at the other. There is that buffer. It's that peer support, that individual who can cut through a lot of the jargon that we at ACS tend to use and can help to simplify and demystify, as Nigel said, what ACS is all about. The second piece is supporting existing foster families, and so again, reaching out to the community to find out where might we, for example, find a respite program for foster families who may need an outlet for a weekend. And that's where the faith community can certainly be helpful. Your doors are open. We know that they're often open after hours that, certainly ACS is not open. And that's certainly a connection that we could make and would love to make with some of you as well. Facilitating visits is the third piece between parents and children and siblings in foster care. So we know that the separation period is traumatic, to say the least, and so it's important that visits, when visits can occur, should occur, and they should occur in the community, not in an agency setting where it's oftentimes unfriendly, sterile, and can evoke a lot of negative emotions and feelings from that child and that parent. So we work with the community to identify individuals called visit hosts, and those individuals locate places in the neighborhood where families can have visits. And so we would certainly welcome the faith community to open its doors to us, for example, to help families have visits in your houses of worship. You might even help us identify visit hosts, people in your congregations who might be supports to families, observing a visit, for example, on behalf of the foster care agency, documenting what they're observing in the visit, and sharing back with the agency the progress that the family might be making. And that's a lot of the work that Raul and Flora and their group implement in the community. The fourth piece is connecting early child care and education programs and preventive programs. So if you're part of a CPP, for example, your faith-based institution may not be a formal preventive agency that has a contract with ACS, but because you're in the room and you're communicating with others, some of those might be child care programs. There's a there's a connection, there's a cross-cutting issue there. A lot of the kids that are in our child care programs are in need of preventive services and vice versa, and oftentimes those two systems don't connect. So the CPP is a forum through which that connection can occur. And then the last piece is building relationships with local schools, because we know that truancy is often an issue. We don't want cases to be called in because of not educational neglect. What ends up happening is that cases get called in by the schools because educational neglect is the thing that the schools think is the problem. When it really could be that the child just doesn't want to go to school. There are other things going on in the home. So again, using the community partnership and that structure that we've helped to create can help to identify where there might be services that that child might be connected to. And so there are other programs and initiatives that the partnerships are involved in, like engaging fathers. There's been a whole lot of work around connecting fathers to taking their children to school. The truancy initiative that the mayor's office kicked off a few years ago was heavily supported by the partnerships. So we asked the partnerships to do a lot. They deliver, and they deliver with limited resources, and I'm sure you'll hear that from the folks on my right. But we certainly appreciate all that they do within a system that we know is constrained with not a lot of funding for this kind of work. So in your brochures, you have a list of the 11 partnerships. I won't go into that in detail, but I will just close by giving you a sense of ways in which your faith communities can be involved in this work. So while you may not see your community listed in the brochure, you don't have to have a formal CPP in order to do the things that the CPPs do. So some of the things could be identifying individuals in your community who want to give love, time, or a home to a child or a teenager, foster or adopted parent. But that may not be the route. The route might just be being a mentor, having an informal group that meets on a Friday because they're young people that you identify within your community that need that kind of support. So it doesn't always have to be the route of foster parent or adopted parent, because that's not for everyone. We would like certainly to increase the number of individuals that can qualify, but that doesn't always happen. So we don't want to necessarily, eliminate all the other possibilities that can occur for families. The second is to perhaps welcome a family into your house of worship for a family visit, a safe place, a warm place. Perhaps host a demystifying ACS workshop, hosting an educational workshop on a safety topic, things like shaken baby syndrome, teaching families how to make sure that their infants are sleeping safely, those are things that we at ACS can help to provide in terms of information, and so we just need the space, we need your invitation, and provided that we have the staff to attend, we will be there. Again, I talked about providing a respite program for your congregants, especially those you know might be in need of assistance. We don't want families to enter our doors through the child protective avenue. We would like them to be supported through our preventive network, and we see that the numbers have shifted, as the commissioner mentioned. So we have twice as many families in preventive services as we do in child protection, and that's exactly where we want it to be. Of course, we would love to have no children in our protective system, but that's an impossibility given the society in which we live. So let's see, the last couple of items, we talked a little bit about the cultural broker issue and the importance of that, and a few people mentioned that. I know the rabbi talked about that, and so we always look to the faith community to help bridge that gap between cultures that ACS may not be as familiar with, and our staff may not have the capacity to work effectively with. So those are just some ways, I think, in which you can be supportive, that we know you have been supportive, and so some of this may just be a reminder to most of you because you're here in the room. It means that you are already active and engaged. So if there are any additional ways that you think you can be helpful, we would welcome you. We turn no one away. There's no help that we would not accept. Our children are the backbone of our society. I think probably all of the religious, what's the word I'm looking for? The Bible, the Talmud, what are those? Scriptures, right? There's something, sorry. There is something in there that talks about the importance of children in our families, in our communities, and keeping our communities safe. And so I won't try to end with anything profound, but I will end
That was
there.
profound.
Yeah.
Okay, now we're gonna put a turbo on it. Gonna zip right through and then get a few questions and then get to lunch.
Okay, so I'm going to talk a little about the Lower East Side. One of the things about the community partnerships is that they do value that each community is unique, has its own struggles, its own concerns, and its strengths as well. Lower East Side, very interesting community. It's been hit by the bug of gentrification, as many of you know. And so because of it, it's a very complex community, a very diverse community. So you have luxury buildings right next to public housing. A large number of public housing. It's not a surprise that the majority of the children in foster care are found mainly in public housing in many of our shelters. And so you also have to work with Asian, Latino. Within the Asian, you have the Chinese, predominantly Chinese American and often overlooked Bengali community that many agencies are not aware of. And so basically it's my responsibility to kind of juggle all of these different moving parts. And so what are the things that we do? Well, as Dale mentioned, we have the 5 tasks that we're responsible for. But really, I see my vision as connecting as many organizations together and having them work more closely with each other so that they can support families better. And at the same time, to find as many community residents who really want to be involved. I see this as an opportunity to develop some of the future leaders of the Lower East Side community. I don't live in the Lower East Side myself, but my connection actually came when I was a high school teacher at Stuyvesant, and I noticed the racial disparities in Stuyvesant High School, and so I decided to find a local middle school to start a tutoring program to work in the Lower East Side on 80 Catherine Street, and that's how I became connected with this community. So through a lot of the work that we've done, through our monthly meetings, we have regular, they have a chance to not only network, but I've used this time along with the leadership because this is a coalition, and in essence, I work for the community partners. I work for the community. And we use this opportunity to provide very good technical assistance, professional development during these meetings. So last year, we did a lot of focus on providing support services for adolescents, because there's just not that much, there's very little service for adolescents. So that was our theme, was providing services and letting our community partners know that these services exist. What do you do? What is FAP, for example, Family Assessment Program in ACS? What does it mean when a teen has a PINS, person in need of supervision? A lot of, as Dale said, a lot of the technicalities of ACS that we work. This year we're focusing on special needs, particularly adults with special needs, because from this work, I noticed that a lot of parents with children in foster care have special needs. And unfortunately, there's not that many services for adults with special needs, especially after 24. So that's our theme for this year, is teaching our providers, what is a Medicaid service coordinator? What is FEGS? What does FEGS do? What is a court-appointed special advocate when the parent goes to court? What is a guardian? What's the difference between that and a guardian ad litem? So that's our focus this year, is we want our partners to be better trained so that they're not calling me all the time. That's the idea. The more they're trained, the less they need me. And that's always what I focus on, is if these systems were in place, really you wouldn't need the partnership at all, because families would be supported when they were needed. So that's why we created the resource guide. We have a 150-page resource guide that has many of our partners and all the services that they provide. That not only that our community reps, so these are volunteers who sit in the conferences, but many of our service providers rely on as well, and it's in PDF form, so I can always email it. We also created, there was a question about how does a family self-refer? Well, one of the things, through our work group, we created a short 11-minute DVD, which you can, by the way, go onto YouTube, and so search LESCPP, no space in between, LESCPP, and it was created to help. It was mainly designed for our family workers at Head Start, who were free to make referrals to preventive service. They saw it as one step closer to having the child wind up in foster care, even though it's called preventive services. And so we created this DVD so that many of our Head Start family workers, as well as parent coordinators, school staff, social service agencies, when would it be appropriate to make a referral to preventive? How does preventive help? We even took the time to talk about the work that our community reps do as well. And so it gives a lot of our partners the tools to know if they decide to make a referral to a parent, say, well, we think you really would benefit from services, because what parent wants to be told you're a horrible parent? We understand that. And we're not saying that. We're not saying that you're being a bad parent. You just need additional resources sometimes. We all need help. I'm a parent. I can tell you, I can always use assistance when I need it. And so we created this DVD, and that's the idea, is that once we have these partnerships, Dale talked about working with schools. We do work with PSIS 140, for example, on Ridge Street, and the parent coordinator always knows to call me. The PTA president knows to call me. Eventually, hopefully, they will not need to call me, and they will know what agency to call. We make a lot of referrals to Grandparent Resource Center, so whoever was from Grandparent Resource Center, we love you guys, by the way. They know to call me, and they've also we've connected them with, let's say they identified employment as a problem with their parents. So we connected them with the local workforce development program. So those are some examples. As far as working with faith-based institutions, and I talked about the diversity of our community, I had the opportunity to speak with Venerable Kongsi at Grace Gratitude Buddhist Temple. And I actually was attending his HIV workshop. And I happen to mention that one of the things that we're working on is recruiting foster parents, and he happened to mention that a lot of the members of his temple, they're looking to China to adopt. Now, while fostering and adopting are two completely different things, I did happen to mention that they're constantly looking to China to adopt children, but there are plenty of children here in the community that need homes, and at the very least, to support children or adopt children who are available for adoption. And this, we actually invited someone to talk about it, and it's still something, it's still a very foreign concept for many of them, but we're hoping that it will get the conversation going. Okay, so we've worked with local churches, both to support families as well as to consider not only foster parents but visiting hosts. I mentioned about the Bengali community in Lower East Side that is often overlooked. I took the time to reach out to the Asafa Cultural Center, Islamic Center, and these are in essence the different ways in how we can be involved, and a lot of it is just really getting our name out in the community, and at the same time reaching out, having our partners really have the tools. And the other thing I tried to work on is, the other thing we often discuss a lot is also the racial disparity, especially in our community. Only 10% of children in the Lower East Side are African American, but unfortunately they make up over half of the number of children in foster care. And this goes back to our discussions of marginalization, discussions of institutionalized racism, or sometimes just letting our partners know, maybe you're not doing enough to really reach out to the families that need the most services. So in essence, that's some of the work that we do at the Lower East Side.
Well, good afternoon. They didn't really leave me a whole lot to say, so I'm going to try to narrow down what I need to say by starting with this. How many people here are the heads or are connected to religious institutions? I need to see a hand so I can see. Good, good, chunky, great. How many people are with a service provider or a community-based organization? Cool, and how many people from ACS? All right, the back of the room. Okay, good, awesome. Well, that makes sense, because they shouldn't be up front. You guys should be up front, because you guys are the focus of all this. All right, another show of hands. Who, at this point, can understand and explain exactly what a community partnership is, or a CPP is? Okay, that's usually what happens, because there's a lot of information being tossed at you. The structure that we use is a little bit different than some of the other groups that you've kind of dealt with. We are not an agency. A community partnership is not a contracted agency. They have a contract with ACS. So one of our agencies is a fiscal conduit that kind of like circulates all the money, signs the contracts. But we are basically made up of agencies, partners, service providers in the community. So there's about 60, 65 different programs that are part of my particular partnership in Bushwick. That includes like the libraries, some schools, 1 or 2 churches, our district attorney, preventive agencies, foster care agencies, domestic violence groups, local shelters, and anybody else that wants to come to the table. It's an open and inclusive group, so anybody in any community can show up at a community partnership and say, I want to join, and that's kind of pretty much it. You don't have to be sworn in, there's no kind of crazy test you got to take. You just have to be committed and understand how we can all work together. So the question is, how can we work with you guys, particularly for the faith-based community? And a couple of examples were tossed out to you. But inherently, we basically just want you guys to use us. And when I say that, I've been in front of several different times. I've done presentations in front of like large groups of religious associations. Kind of talk to them about what we do as far as the network. But it kind of always comes down to 2 things. The difference between resources and partnerships. Now, to use this as a resource means when you need something, you call us, we give you some information, boom, hey man, that was great. And if you need that information, if somebody else does, you pass my name on, and that happens. It's not a partnership. We're trying to foster partnerships. Like Flora was saying, the better she can get an agency to understand and to be connected, the less they need us. So it shouldn't be every time, oh man, I gotta call Raul or I gotta call Flora. It should be like, wow, I need, I've already created a relationship with these other agencies. I've seen them at the same meetings. It's not a phone call anymore. I know the face that I'm talking to. That creates a much stronger safety net for the families that tend to slip through the system that's built the way it is. This is the number one thing I could say. Because you guys are in contact with people that we cannot reach. Most of the services, ACS is a crisis-driven system. Something has to be totally out of whack. Somebody has to call for help for them to be able to come in and say that we need to help this family. We like to try to get to families before they get to that point, so they don't become known to the system, so they get stronger support, so they can tap into those services before it gets to the point that they're forced upon them, where the trauma slips in. I know that for my community, I'm talking about Bushwick, it's 70% Hispanic. About 15 years ago, it was 70% Puerto Rican. At this point, the Hispanic numbers, a countless number of countries up and down Central America, Mexico, Latin America, the Caribbean islands, but still, 56% of the kids that are in foster care are African American. I live in a community that doesn't reach out when they need assistance. I know that they're better at calling a pastor, walking up to a rabbi, talking to someone at their religious organization when they're having a problem, as opposed to reaching out to the police or making a call to ACS or walking through the door of a preventive service agency in their neighborhood. And I say that because one of my partners was a parent advocacy that was working on early literacy. That was their thing. They moved in. People would walk by, look at the storefront. Sometimes they would peer into the glass. Sometimes they would open the door and just ask what kind of an agency or what they did. They would tell them, and then they would keep moving on. It wasn't until the next door neighbor, which was an old man who they called Grandpa, who ran it was a pet food. It wasn't a pet shop, but it was a pet food shop. He came in and asked what did they do and what kind of stuff they did, and they were like, well, we try to connect young kids to early education programs. Well, he had his grandson who was about the right age, and they were having some issues trying to find him some services. So they were able to connect him and his grandson to an early intervention program. After that, people started coming through the door, because Grandpa then told the other neighbors and the other people that in the neighborhood, hey, no, they're okay, and this is what they do, and if you got this problem, you should go over there and start working with them. 7 years later, they've worked with 5,000 families, just because somebody broke that ice and gave them some street cred, and all of a sudden, okay, they were okay to be approached. That's primarily what you can do for us. When I talk to pastors and other religious leaders, they're always like, well, these are the problems that sometimes I get. And eventually I get a homeless guy who'll walk in and is looking for help. Or family members dealing with a drug issue, and they're trying to find them an appropriate service, but they don't want them to go away for 9 months or 6 months or whatever. Or they're not at the right place to be able to reach services, or someone's dealing with a domestic violence situation. What I tell them is that I have partners that handle all of that. In those group of 60 agencies, I can pretty much, if I can't find a service provider that would help them, I will seek out somebody who can give me that information and get that to you. With the partnerships we got now, if somebody called me and told me, I have a mother, domestic violence situation, she has 3 kids, probably within a half hour, I can find them a shelter placement. And within an hour, I can tell them where they need to be so a van can come and pick them up and take them to an undisclosed location. And that's because of the partnerships that we've developed with the different groups in the community. Besides tapping in, helping us tap into an unreachable group, we ask you to be able to provide the stuff that you guys have. As Dale said, you guys have space. There are plenty of organizations that are probably walking distance from most of your sites that probably could use visitation space for those families that are in foster care that are trying to reunify. I don't know if anybody's ever worked with a foster care agency or has been at a family visit, but most of the times they have it in what they call their family room. So it's a small office, nowhere near the size of a living room. Usually got one of those padded couches. And some of those toys that you used to remember from kindergarten, those like vinyl puppets that are all in the corner. Maybe a painted mural on the wall, but that's it. They do their visits there and they're supervised by a worker. It's a real sterile environment, and a parent almost doesn't have the chance to be a parent because they're still being watched by somebody else. And it isn't an environment where you're gonna have to parent your kid because there's no interaction with anything else. So what we do is we try to provide, as part of our mandates. I got time? Okay. A minute. Okay, that's good enough. We try to provide situations where we do visits out in the community. I know right now I have an agency that's bogged down because they have more cases than they have space. And I'm actually reaching out to one of the local churches who happens to be down the street to see if they can use some of their space during the evenings for their family visits. It's an easy win-win. So please, you got all of the information. There was a 2-page thing with a bunch of like multicolored lines on it that shows you all of the partnerships and the ACS leads. If there's a community that's near yours and you don't have a partnership, call one of us that's near you. We should still be able to connect you to something. Also, you guys are our eyes and ears. If you kind of tell us some of the issues that your families are dealing with, and we can pass it up the line. And when I talk pass it up the line, I mean pass it up to ACS, up to the commissioner, up to city government. You know, it gives us an opportunity to kind of be able to deal with some of those things. When you tap into me, you tap into all my partners, which means that I can provide workshops for all of these professionals, whether it's education, early education, domestic violence, mental health, substance abuse, just by making a couple of phone calls. You know, like I said, Flora has done it, I've done it, all of our network do something along that lines, and they usually do it along the lines of their particular group. No problem. That's it. Thanks a lot for your time.
Thank you, Tom. And in keeping with the flow of the previous panels, I'm just going to ask if you have a question, state your question and step back from the mic. I'm going to take about 3, given where we are right before lunch. So if you have a question, a burning question, this is the time to ask your burning question. This is part 2 of the first part.
Just a quick thing. What if there are like the communities that we are kind of concentrated in aren't necessarily in the 11 communities that you service? What if there is something that we would like some workshops or something in a community that's out of these 11 kind of neighborhoods? Is that something that can be accommodated somehow?
Sure. I mean, I think as Raul said, if there's an adjacent community partnership, you can certainly reach out to them, but you can contact the Office of Community Partnerships. And there's a number on the back of the brochure, and if we have staff that can attend, and sometimes because we are, as I said, lean, it's difficult to have someone come out right away. But we could also rely on our partners if they have connections in neighborhoods that are close to yours. But we also have networks within ACS of providers that can go out, and other divisions can make presentations as well. So just let us know, and then we'll do what we can to support you.
And just to say, outside of that, because she's talking about ACS staff, if you needed something along the lines of like preventive services or domestic violence, something like that, we can contact the agencies that do that in your neighborhood and connect you to them. So it's not just like, you know, because everybody's providing services. There's always somebody that's going to be doing it in the neighborhood that you're looking for. It's just, it's kind of like, I always see ourselves as electricians. We connect people to power sources. So even though you're not in my neighborhood, I might be able to find somebody that's working in your neighborhood that can do what you do, and then you can start your own kind of connection there.
Okay.
So, not a problem.
And just to give you an example, we noticed a lot of our parents were moving to Parkchester from the Lower East Side, affordable housing, once again. And so since Parkchester is adjacent to Soundview, what I would automatically do is contact the Soundview coordinator and see if they could connect some of our parents with resources. Also, our cultural brokers are, each within the 11 partnerships, each borough basically, each CPP within each borough has, was given some funding to do cultural broker recruitment, and so Lower East Side was one of them. So we made a commitment to serve borough-wide. The other thing that we did is that since we work with 2 preventive service agencies that are actually contracted to serve the Chinese American community, in this case Chinatown YMCA and Chinese American Planning Council, we had an agreement that our cultural brokers can also serve families from Brooklyn and Queens, really anywhere outside of Manhattan as well. So that's another way. And again, I also want to emphasize a lot of the preventive service agencies. Later on, there's going to be a discussion about cultural broker. A lot of them are actually contracted, work with a particular community.
Thank you. Thank you.
Thanks for your presentation. Now, in my organization, let's say I adopt a family, but we are incapable of satisfying their specific needs. What should we do? And what tools are available to assist us to meet those needs?
Is that a general question?
Well, based on the adoptive family.
Is that a general question, or
Yeah.
is that a specific question about
Well, it's
real
both.
life?
It's real life, yeah.
All right, I'm going to ask that you talk to one of the representatives after when we get to a break.
Thank you.
Next person, please.
TK Nakagaki. Actually, sometimes when I'm talking to some of the Chinese community, Buddhist community in general, there is a big gap between the, what does that mean, the parenting. That makes it really difficult, because the traditional value that they carry, it doesn't work here. In that case, how you can be a parent, or how can your children be acting? I mean, that was a big question that I myself has, and if you have any suggestion or interesting the maybe project that we should be doing from the some of the Asian communities and so forth, is that my concern. Thank you.
It's, when I first reached out to the members of Asafa Islamic Center, I remember having a discussion with one of the members, and he said, I explained to them about, some basically, where you cross that line with, when we get into corporal punishment, for example. And I remember him answering me, the Quran teaches us to follow the law of the land. That was, and it stuck with me to that day. The Quran teaches us to follow the law of the land that we are in. And so I've always used that when we're talking about bridging cultural divides, that, again, I have to emphasize the importance of parenting classes. A lot of so not even just the preventive, but other organizations, we work very closely with Henry Street Settlement's Parent Center, and they regularly provide parenting classes. A lot of our preventive service agencies actually provide parenting classes in that language. And it's not necessarily, to me, it's working with, Diane, who often talks about strength-based. Okay, we do believe that every family has their own strengths. And it's being able to tap in those strengths and understand that you are in a new environment. I mean, I grew up with corporal punishment. That was, this was not, to me, that's how I was raised. And for a while, even before I started this job, I was very adamant. I said, I'm sorry, some kids need to be spanked. That was my mentality. And after being a parent myself and doing a lot of the work, now I'm all of a sudden aware, well, maybe that's not the best way to do it anyway. And there are other ways to help parents realize that you can still be you. Timeout might not work for every parent. So you can try other methods that help still see the child understand consequences. My belief is always actions, consequences. Every action you do has a consequence. And if you can instill that, and you talked about compassion too, if you can help parents understand that you don't have to change, you might have to modify a little, but you do have to change, and and in some ways realize that maybe what you were taught might not have been the most effective method anyway, at least not in this environment.
All right, next person. If there's line up because after the next one or two, we're going to move to lunch. Yes.
Good afternoon. My name is Daisy Dennis, and I work at Harlem Children's Zone in general preventive services. We have a lot of families that are now located on the Lower East Side, so I believe this question should be for Flora. And we find it difficult finding other programs in that area for our families who are located there, and many of them are in shelters, such as after-school programs, daycare, pantries, and things like that. And I want to know, how can we get our resources as to what is available down there for our families who are located in that area?
I will definitely give you my card, so when you see me, and what I could definitely do is email you the PDF version of our resource guide. You could use that as a basis, and if you need additional services, you can always contact me or come to our monthly meetings. Third Wednesday of the month, 273 Bowery at House and Street Center.
Okay. And I would advise as many people as possible to get your card, because a 150-page resource guide probably has much of the answers to the questions that you may have, or at least begin a very productive way of solving problems. And while I am speaking, I would be remiss if I did not acknowledge the presence of the Dean James Parks Morton, who is the founder of the Interfaith Center of New York, who is my godfather when I worked in the Cathedral of St. John's, and he was the one that pulled me into this over 20 some odd years ago. He is a spiritual father, a friend, a visionary. Can we put our hands together for our founder and leader, James Parks Morton? The right reverend. Yes, sir. Last question.
My name is Swami Formation, and Jim and myself are in Syria and Lebanon. And when I think about what is going on in Syria now, I mentioned it to Jim, and he says, we ain't going back there.
That's true.
I'm a Hindu monk in Jamaica, Queens. Among other things that I'm experiencing difficulty is a lot of people who are having these family issues, they're illegal aliens. And the question is being asked, when I say go to the agencies and you'll get help, they're afraid to go. So what can I say to them to break that barrier so they could go and get professional help? Because I know my limitations. Like, I could go to a certain point, they'll say pray for me, and they believe in prayers, but then I don't have that technical help that you have. So how can we bridge that?
Thank you, sir.
So, I'm not the expert in that area. I would defer to my colleagues in FPS, if there's anyone that can, Family Permanency Services in our foster care area, to talk a little bit about whether or not, or how ACS handles situations around families that may not have legal status in this country. Because I think you may have some information to share about that. I can't.
Come to the mic, please.
We do that in collaboration with FCLS, our Office of Legal Services, actually, as well as the Office of Advocacy. So the Office of Advocacy has a director that works to assist families who are engaged in foster care services, either the youth themselves, because we do have a lot of young, older youth that come into care, where we have to assist them with achieving citizenship within the United States, as well as family members who would like to provide services through either kinship care or foster care. We work to try to make that happen through the Office of Advocacy and also through the court services, depending on the actual immigration need, which varies. So I would refer you to the Office of Advocacy at the Administration for Children's Services, and Family and Permanency Services can link you to them.
And Colleen Duffy, I think, is in the back of the room from Advocacy.
Yay, see, there you go.
And she can probably give you some details around what kinds of information ACS can and cannot share about a family status. Right?
Colleen, you're going to talk to our brother, correct? Yes. And I believe the last question is really the power of coming together, finding both information and inspiration. Inspiration is great, but we need information to parallel. And as a religious leader, regardless of denomination and or faith tradition, people look for you for information, even if you don't know. So being able to jump and to be a part of an entity and to partner with folk who have information, and with that comes trust. And trust can only happen in relationship. You cannot have a relationship without being in a relationship. I'm sure some of you figured that out by now. Right. But just in case there's somebody that has not, it will not happen. So I want to thank ACS. I want to thank all of the presenters in absentia, your leader, the commissioner. Now, Vernon, this is the time to say all of those things. And to the ACS staff that are here, and to be able to work with you, to see you in the community, to see you in houses of worship late at night. Sometimes I have to take Yolanda and drive her to the train station so she can get home to her own family, so nobody call up on her, you know. That was a little inside joke there. So, with that said, we have concluded this segment. I will bring my dear sister and friend, Sarah Saeed. I should be more formal, Dr. Sarah Saeed, if she would come forward and move us to what I hope is lunch.